question. Right. So if you have read and understood, considering it critical care scenario, kindly tell me, how would you manage this patient now?
Yes, ma'am. I will manage the patient according to ATLS protocol.
Okay.
First of all, I will check the airway,
Yes.
that is patent or not. I
Yes.
will simultaneously resuscitate the patient and
Okay.
remove any foreign body or bleeding into airway
Yes.
if there is any obstruction by giving suction.
Yes.
And at the same time, I will do airway maneuvers if needed, and then I will go for checking breathing and ventilation. I
Yes.
will check vitals like oxygen saturation and respiratory rate, and I will go for checking any chest injury if there is any chest injury or not. And then I will, after ensuring proper ventilation and giving 15 liter oxygen per minute, and then I will go to check circulation and start crystal fluid by establishing white bore cannula. And I will check if there is any active bleeding or not. In this case, there may be laceration on the skull associated with head injury.
Okay.
I will take control over that.
What
And then
yes. Yes. Good.
yes, ma'am.
Thank you. Okay. After you have reassured all your ABCDs, what investigations would you ask for?
I will ask for, as this patient has a GCS 8 after 15 minutes
Yes.
of arrival,
Yes.
I will do a CT scan of it.
Okay. Right. Can you tell me what might have caused drop in the Glasgow Coma scale of this patient from 15 to 8?
There may be head injury, certain
And-
head injury, and
and
raised ICP, raised
intracranial,
intracranial pressure.
yes, yes, that might have led to, what are the consequences?
That might have led to altered consciousness level.
Okay, there is a particular name for this kind of consciousness level. Can you tell me? What does it call?
Initially, it was GCS was 15, and later it iterated. It is called lucid interval.
Okay. What happens in case of lucid intervals?
In lucid interval, initially the condition improves for a certain period of time, and then
Yes.
rapidly
There is-
deteriorates.
Yes,
The
there is
intracranial
accumulation
pressure
of,
rises to a certain level.
yes,
Yes,
there is accumulation of blood in the extradural spaces
blood in the
that
extradural
leads
space,
to increased intracranial pressure, and that
intracranial
leads to
pressure, and
cerebral edema. These are the sequences you have to tell me. Okay, can you tell me what are the signs or symptoms that you look for which will signify that the patient has increased intracranial pressure?
there may be symptoms like headache, vomiting,
Yes,
altered
very good.
level of consciousness,
Yes,
and there may be signs of fracture of base of the skull, like raccoon's eye, battle sign,
very good. And
CNS rhinorrhea, otorrhea, or
yes,
hemotympanum,
or there
and
could even be papilledema.
the papilledema,
Yes.
lateral gaze disturbance, and there may
How would the
be
vitals be?
dilated pupil.
You'll do the vitals of the patient. How would you find the patient?
In this case, there may be Cushing's triad present.
Very good.
In that
Increased
case,
blood pressure.
hypertension,
Very
bradycardia,
good. Very good. Yes.
and irregular
Bradycardia? Yes,
respiration will be
very
found.
good.
Yes, ma'am.
Okay. Can you please tell me what is the normal value of intracranial pressure?
Normal value 7 to 15 millimeter mercury
Very
means
good.
supine
In the
position,
spine. Yes,
standing,
very good.
10
Very
millimeter
good.
mercury.
Okay. Can you name few ways by which you can measure intracranial pressure?
Yes, ma'am. There are some invasive methods and some non-invasive.
Yes.
Invasive method like interventricular catheter, that is the gold standard, and the non-invasive methods include intraparenchymal probe, intraparenchymal probe, subarachnoid probe, epidural probe, lumbar puncture, lumbar CSF pressure measurement, and tympanic membrane displacement,
Okay,
transcranial
good.
Doppler.
Can you please differentiate between Cushing triad and Cushing reflex?
Cushing reflex is the mixed vagal and sympathetic response
Yes.
Following raise of intracranial pressure.
Yes. Which
At
leads
first,
to which leads to
which leads
hypertension,
to
hypertension,
hypertension,
and there is
and
also
bradycardia,
yes bradycardia. So in
and
case of
finally
Cushing
irregular
triad, there is also
breathing.
hypertension and bradycardia. What is the third symptom which is present?
There is also irregular respiration.
Yes, very good. Okay, can you please tell me if what do you understand by the term Monro-Kelly hypothesis?
Monocally hypothesis means the brain skull is a fixed box
Yes.
containing three components: blood,
Yes.
CSF, and brain. Uh, and rise in the volume of one component will cause a depletion of another component.
Very good.
And
Okay,
that is the way of autoregulation.
Very good. Can you please tell me how would you regulate if the patient happens to have increased intracranial pressure? How would you regulate that? How would you manage it?
If intracranial pressure is raised, I can decrease I can attempt to decrease the venous drainage of increase the venous drainage of brain by positioning the patient's head end of the bed 30 degree
Yes.
propped up, and
Yes.
I will ensure neck alignment, proper neck alignment, and I will immobilize the cervical spine by putting sandbags, and I will check if patient is intubated, I will check the tube ties are not compressing the interjugular veins. In that case, I will loosen up that, and after that, I will go for reducing the cerebral edema
Yes.
by
Yes.
giving mannitol.
By your yes.
I can give mannitol
Yes.
and
Yes.
as well as loop diuretics like furosemide. I
Yes.
will keep the sodium level, serum sodium level between 140 to 145 millimole per liter. Then to decrease the cerebral metabolic rate for proper oxygenation, I will maintain the I will minutely maintain the temperature. I will avoid hypothermia, as well as
Okay.
I will not
Can you yes, good, thank you. Can you please tell me, would you or would you not consider doing lumbar puncture if patient has increased intracranial pressure?
No, ma'am, lumbar puncture may deteriorate the condition by
Yes.
causing several herniation and coning.
Very good. So you'll not. So in case if there is in case patient stabilizes and there is no more risk of intracranial hypertension and pressure is normal, and you happen to do lumbar puncture, can you tell me your needle will pass through what layers?
Needle will pass through skin,
Outside to
subcutaneous
inside. Yes.
tissue,
Yes. Yes.
skin, subcutaneous tissue, ligamentum flava, uh, interspinous ligaments, dura mater, subdural space, arachnoid matter, and subarachnoid space.
Okay, can you tell me when should you choose to intubate your patient?
I will go for intubation if there is GCS is equals to or less than 8 at the time
And
at the time of presentation, and then if the patient if there is risk of rising ICP due to agitation, if patient needs if patient has seizure, if patient has lack of control of airway, or if there
yes,
is loss
yes,
of
yes,
protective laryngeal reflex, and if there is bleeding into mouth or airway, if there
yes.
is severe
Any
facial
risk of
fracture,
hypoxia. Very good.
bilateral mandible fracture.
Excellent. All right. Just suppose you've done an imaging on this patient. Can you please help me to read? And this imaging shows something like this. What do you see and when would you see this kind of image?
This is a CT scan of head, axial cut section showing biconvex hyperdense lesion in the parietotemporal region,
Yes.
and it indicates extradural
Okay. There
hemorrhage.
is one is biconvex shape and it is hyperdense. Then there is midline shift.
There is midline shift and
Yes.
ventricular compression.
Compression of the ventricles. So 4 things. Okay, very good. This signifies what type of head injury?
This signifies extradural hemorrhage.
Yes, very good. How would it be if it was subarachnoid hemorrhage and you had done CT scan?
Subarachnoid or subdural?
This is extradural, subarachnoid.
In case of subarachnoid, crescent shape
Yes.
hyperdense
Yes.
lesion.
Good,
There.
good, good. Thank you. Excellent.